Hello everybody and welcome to the Tuesday edition of Video Clips, and as usual I start the Tuesday Video Clips with announcements about things that are upcoming. And so anyway, first thing, reminder, Dr. Bregan will be with us at the end of March for 4 days. Peter Bregan is, I think, the world's most important psychiatrist. He will be here filming video lectures, which are going to be part of our recently approved program called Why and How to Withdraw from Psychiatric Drugs. Very excited about offering this program, which we'll be ready to let people sign up for late spring, early summer. Eileen Kopsaftis, our physical therapy partner, will be here for 3 days doing workshops in one of our employer accounts and also doing a workshop here on the evening of March 16th. This woman is an amazing physical therapist, and if you have to drive a long distance to come here and have an appointment with her, take part in her workshop, I strongly advise you to do it. And then, of course, always the Brand Ambassador Program. You want to get special stuff, like last week our brand ambassadors got to be in a private conference call with Dr. Neil Barnard about his upcoming book on cheese, and they're going to get a private conference call with Dr. Bregan. So you have to do some things to qualify, but then you get real special privileges and you can help us spread the word about what we do here at Wellness Farm Health. Operation Healthy Girlfriend, if you are female and you want to start a chapter in your area, this is a fun way to help other women improve their health and help you to improve your health too. So send me an email if you'd like to talk more about this. And last but not least, summer semester. I know it is early in the year, but we have to plan ahead. It is posted on the Wellness Forum Institute's website, so you can take a look at what we're doing this summer, which is pretty amazing. All right. Couple things I want to talk about today. The American College of Physicians just published updated guidelines for treating back pain, and they advised against medication and instead recommended non-pharmacological options in most cases. So the new guidelines say instead of taking opioid painkillers, anti-inflammatory drugs, or muscle relaxants, people with back pain should try therapies like exercise, acupuncture, massage therapy, and yoga. I've been saying this for years, that most of the stuff we do to people who have joint and back pain really doesn't work very well. Doctors should inform patients that they will almost always get better regardless of the option they choose. The guidelines state that steroid injections and acetaminophen are not helpful, and another term for that is useless too. One of the authors of the new guidelines, Dr. Rick Deo, says that most people with acute back pain don't even need to see a doctor. He compares back pain to the common cold. It's annoying, but it's not serious, and it will eventually go away. Now, people who have chronic back pain, which is defined as 12 weeks or longer of back pain, should also start with non-pharmacological treatments, according to these guidelines. If patients want medication, just ibuprofen or aspirin are recommended. And again, the guidelines pertaining to chronic back pain patients say that consultation with a medical doctor and intervention are generally not advisable. Scans such as MRI are not only useless but harmful, say some of the authors in a telephone interview. The reason is the scans show abnormalities that have nothing to do with the pain. And by the way, there's a long history of the fact that the images have nothing to do with the pain. And that's why so many of the surgeries that are done for orthopedic purposes and for back pain end up being completely useless, as they're done on the basis of images that show abnormalities that might be there but have nothing to do with what's going on. And by the time you're my age, I'm 60, almost all of us, if we had enough joints scanned, we'd find abnormalities, even if we don't have any pain. So anyway, they advise against imaging too. The treatments traditionally offered for back pain that are so ineffective that even placebo is more effective. And this placebo effect holds true even when people are told they're getting a placebo, which I think I'm smiling because think about it. The treatments are so useless that even when you tell somebody, here's a pill, it won't do anything for you, it's better than if you have the treatments. I mean, some of what is done in medical practice does just kind of make you laugh. The placebo effect also results in similar outcomes as acupuncture, massage, and chiropractic treatment. According to John Standard, MD, people with back pain tend to restrict their activities, believing that activity will make things worse. Echoing the work of Dr. John Sarno, who wrote a great book called Healing Back Pain. By the way, there are 2 lectures based on that book on the advanced study platform that you can access through Wellness Farm Health if you have a passcode. Anyway, Dr. Standard says the best way to help patients is to reassure them that they'll get better, to encourage them to work toward normal activity levels and have a normal life even if they have some pain. He says that people who believe they will get better usually do. And in fact, that's what Dr. Sarno's book is all about, is that he called it knowledge therapy. He'd bring these people in a room and say, go home, live a normal life, start exercising, and your pain will go away. And it almost always did. I've met a lot of his patients who said that that was the case. In an accompanying editorial, Dr. Stephen Atlas, a back pain specialist, questions whether or not the new guidelines will be adopted. He shares my pessimism for these things. Doctors don't listen to their associations anyway. He says patients are looking for cures and easy solutions, and the recommended therapies usually require some work, and that's true. But the missing link in all of this is informed decision making. In other words, if patients had really good analysis of risks and benefits for everything, including, in this case, pain pills and orthopedic surgery, they would opt for other things if they saw the outcomes. Another issue is incentives that are built into medical practice to recommend scans and drugs and surgery instead of better protocols like yoga. These options are, the scans and drugs and therapies are very profitable for physicians, while referral to a yoga studio doesn't make the doctor any money at all. And insurance doesn't pay for yoga, but reimbursement is available for surgery and doctor's visits to fill prescriptions, which is a lot cheaper for people to go to yoga, but insurance companies really don't have any incentive to lower costs right now, thanks to the Affordable Care Act. Dr. James Weinstein, another author of the guidelines, says, quote, what we need to do is stop medicalizing symptoms. Pills are not going to make people feel better, and as for other treatments, he says, yoga and Tai Chi, all those things are wonderful, but why not just go back to your normal activities? I know your back hurts, but go run, be active, instead of taking a pill. Could not have said it better. And while we're on the subject of useless medical care, which is most of it, according to a recent study, lung cancer screening, even for patients at high risk of developing lung cancer, harms many more people than they're helped. And when you hear the statistics on this, it is almost mind-blowing. Over 2,000 patients of the Veterans Health Administration were included in the study, and low-dose CT was used for screening. Lung cancer was diagnosed in 1.5% of the patients, but most of the patients who were screened were what they call false positives, and incidental findings were reported in over 40% of them. At 8 VA sites, the cohort started with 4,246 patients who were eligible for screening based on the guidelines published in 2013 by the U.S. Preventive Services Task Force. Now, just over half of them said, okay, I'll agree to the screening. Incidental warnings that might warrant follow-up were reported for 40.7% of the patients and included things like emphysema, pulmonary abnormalities, and coronary artery calcification. The overall rate of false positive results was 97.5%. Okay, we keep doing this stuff. It's astounding to me. In an accompanying editorial, Rita Redberg and Patrick O'Malley, both medical doctors, reported that the screening program was highly resource intensive with very poor results. Based on the data, listen to this analysis, for every 1,000 persons screened, 10 will be diagnosed with early stage lung cancer, possibly treatable. 5 would be diagnosed with advanced lung cancer, not treatable, not curable. 20 patients would be subjected to unnecessary invasive procedures, which include all kinds of things that require general anesthesia. And 550 would experience unnecessary alarm and repeat scans with associated radiation risks. So here's what this boils down to. You screen, for every 10 people that you benefit after you screen 1,000 people, you hurt 570. Help 10, hurt 570. You think about this as you would apply it to any other industry except for medicine, and the Attorney General would shut down businesses that had a track record like this. Redberg and O'Malley further state that it's very important to limit screening to people who are likely to benefit, quote, in a fully informed, shared decision manner. Again, we're seeing more people advocating for informed decision making. More people are realizing that the problem is the patient doesn't have all the knowledge. That's what we do here. That's why you're watching these videos, so you can be an informed patient. You want to take a step further, join Wellness Forum Health, get involved in our programs here, and you'll know more than most of your doctors know about much of what goes on with your body. In spite of this, the authors note, most lung cancer screening is occurring in patients who do not qualify. More never smokers and low-risk smokers are getting screening than high-risk smokers. Redberg told Medscape News that, quote, early detection is not always better, and we detect things that we do not need to worry about. When applied to the entire VA population, now remember, you screen 1,000, 10 people benefit, you hurt 570, okay? if you look at the whole VA population, the researchers who conducted the study estimate that 900,000 patients would be eligible for screening based on their smoking history, and that accurately identifying the patients and having discussions about risks and benefits would require significant resources. I'm sure that won't stop it. The fact that you spend all this money and time and you hurt more people than you help never stops anything in healthcare. But based on this, and this is my interpretation of the data, if you multiply it out, 500,000 patients would be harmed if all of the people were screened. 500,000 in order to identify 18,000 people who might, not definitely, but might benefit. Dr. Redberg says these are not good odds of benefits, you think, and this is likely the best data we'll get. In 2014, Dr. Redberg chaired the Lung Cancer Screening Discussion Group for Medicare Evidence Development and Coverage Advisory Committee, which advised against low-dose screening for lung cancer based on the reasons identified in this recent study. Made no difference. In 2015, the Centers for Medicare and Medicaid Services, or CMS, agreed to cover lung cancer screening anyway. It's one of the reasons why these programs are going bankrupt. They insist on doing things that cost a lot of money and hurt far more people than they help. And by the way, those people who are hurt, then they have to spend money on these people to make right the damages that were done for doing things to them that they shouldn't have been doing in the first place. So the whole it's very frustrating. So as with many recommended tests and treatments, the only way people who fall within the eligibility criteria for lung cancer screening can avoid being hurt is to just say no. In other words, you may well fall within the eligibility criteria when you visit with your doctor for lung cancer screening, but that doesn't mean you're going to benefit. In fact, remember, 97.5% of the people did not benefit who in that group that did qualify for screening in the VA cohort. So the odds are 40 times higher that you'll be hurt than you'll be helped by lung cancer screening. So it just boggles the mind. Like I said, in any other profession, if you have a home improvement contractor, a plumber, or somebody who built houses or repaired air conditioning units, come up with anything that people do that involves charging people money for services offered, and if the track record was this bad, they'd be in jail, all right? And yet we let this go on in medicine. And I remember a few years ago, my friend and colleague, Dr. John McDougall, writing an article that made everybody so upset. He was talking about cardiologists are really criminals. And people were saying, you know, John, you shouldn't be so cynical and you shouldn't be so in your face and all that sort of thing. And I have to admit, at the time I was like, yeah, I don't know if we need to go there. But, you know, I'm on board with that. I don't know what else you call this kind of stuff. It is criminal behavior. And the fact that we as taxpayers pay for a lot of it just really floors me. I'm astounded that it goes on, and I'm astounded that the whole country sits there and watches it. You know, I'm tired of watching it myself. But anyhow, that's why I show up at work every day. That's why I do these videos every week. This is all for Tuesday. As usual, pass this on to anybody who you think will enjoy watching it, and I'll be back to you on Thursday with more news.